Ladies and gentlemen, welcome to MedSynapse. Today we're delving into a fascinating topic, exploring oocyte cryopreservation, fertility preservation through egg freezing in short. Joining us is Dr. Navdeep Singh Pannu, a consultant obstetrician, gynecologist, and fertility specialist at TMC Fertility Centre in Puchong, Malaysia, where he's currently the medical director. Dr. Navdeep's impressive background includes specialist training at the University of Malaya, laparoscopic surgery expertise in India, and a course on assisted reproductive techniques at the National University of Singapore. Welcome, Doctor.
Thank you very much for the kind introduction, and thank you very much for inviting me to give this talk today.
Thank you so much for being here with us today on this important topic. For our audience, in today's discussion, we will be covering three main aspects of oocyte cryopreservation, where we will be exploring the procedures and the candidates' criteria. We will compare it with other methods, and we will dive into the crucial considerations and ethical dimensions. So, without further delay, let's begin our podcast. Dr. Navdeep, to begin with, could you please explain the process of oocyte cryopreservation and its role in fertility preservation strategies?
Well, firstly, when a patient comes in for oocyte cryopreservation, also termed as egg freezing, what we'll do is we will give them injections for about 10 days. These injections are to stimulate the growth of the eggs. So once the eggs have reached a nice size after 10 days of injections, we'll give them some anesthesia and we'll do an egg retrieval procedure to them. And once you have got all the eggs, then we will freeze the eggs in the canisters in our lab for future use. So generally these procedures can be done for any woman from any age group in their reproductive age group, which is like the best time is about when they are about 30 years of age. So this procedure, the benefits or the main role it plays in our fertility treatment nowadays is it can prolong or lengthen the fertility capabilities in women. An example, once a woman have reached the age of 40 and above, their reproductive potential tends to drop. However, if they had frozen their eggs at a much younger age group, then they can use those eggs at a later date to get their babies. So there's a lot of fertility potentials in this particular procedure.
Thank you for that clear and nice introduction. Preserving fertility is indeed very important for many patients. Now, moving on to our next question. Who are the optimal candidates for oocyte cryopreservation, both from a medical and personal standpoint?
All right. The best candidates who can benefit from these would be women in the reproductive age group and, as I mentioned earlier, around the age of 30s. There are a few types of patients here. Number one, those who have medical indications, which are patients who are been planned to undergo chemotherapy or radiotherapy, where with the exposure of those kind of cancer treatments, their fertility potential or their ovarian reserves will tend to reduce. So what we do is we give them the injections, get the eggs out and freeze them before they go for the procedure. Another indication is the social indications. Some women, due to their education, they want to continue their studies, or they have the career options that they want to continue to move up in life, some personal reasons or financial reasons, or those who have not found their Mr. Right yet. Those women generally can also freeze the eggs. And the third group of women are the women who do not want to freeze embryos for ethical, even personal reasons. So what we do is we will retrieve the eggs out, and we only fertilize a few of our eggs, and we will transfer those embryos accordingly. And the rest of the eggs we will freeze it for their future use. So these are the three main groups who generally come along to freeze their eggs.
Now, let's explore the contraindications. For whom is oocyte cryopreservation contraindicated?
There are not many contraindications when it comes to oocyte cryopreservation or oocyte freezing, if religious beliefs are against it. Number two, in patients who have multiple ovarian cysts, or certain ovarian cysts, for example, endometriotic cysts, for which she has undergone multiple surgeries and they have and she still has a cyst over there, then I will not do it for her, because the risk of puncturing those cysts, and hence there will be risk of infection. So certain patients who have cysts, we will advise them to do certain surgeries to ensure that the cysts are out. Then we can offer them the procedure. The other one will be patients with bleeding tendencies. So if they have bleeding tendencies, then they can bleed quite a lot. So these are the cases that I would not advise them to freeze the eggs. The other group of patients probably be those who have inherited genetic abnormalities, which they can pass on to their offspring. So I guess those patients too, I would advise them against this procedure. As I mentioned earlier, there are not many contraindications. This procedure is quite safe and can be offered to a wide range of patients.
Now, how does the process of egg freezing compare to other fertility preservation methods like ovarian tissue freezing or embryo freezing in terms of success rates and patient experiences?
Well, the first thing is that when you talk about ovarian tissue freezing, the patient will have to undergo a laparoscopic surgery where we have to excise the cortex of the ovary, and we have to process it and slice it very thinly and then preserve it for future use. Once the patient is ready, then we can reattach those strips of ovarian tissue onto their ovaries, and then it'll be as usual where we give them medication to grow their eggs, and their success rates are quite good. But you'll have to undergo two surgeries. One is to excise the tissue, and secondly to reimplant those tissues on their ovaries. The second thing would be the embryo cryopreservation or embryo freezing. In my opinion, that is the best option, okay, because that's the easiest and safest cell to freeze. So in this kind of process where we will give them injections exactly like IVF for 10 days, then retrieve the eggs and create the embryos in the lab. If she has excess embryos, we will freeze it for future use. Otherwise, if she wants to get pregnant at that particular time, we will transfer the embryos, and we can keep the embryos till eternity, how long they want to keep it. So some patients even keep it till they reach a certain stage in their life, then they are ready to have their second baby, or those who want to start a family at a certain age, they can use it. So embryo cryopreservation is the best because they do not need to have any form of injections when they want to prepare their womb for pregnancy. The other thing about the oocyte cryopreservation, as I mentioned, is all IVF treatment, give injections. So the risk involved includes ovarian hyperstimulation syndrome. That means the patient has a lot of eggs, they feel very bloated, they have heaviness or lower tummy, and some of them have to be off from work for a few days to recover. So as a fertility doctor, the commonest thing that we face would be, or rather the thing that we want to avoid the most, will be the ovarian hyperstimulation syndrome. But with recent technology and advancements in medication, so thankfully the moderate or severe ovarian hyperstimulation syndrome is very rare, so we don't see it very much.
Now, moving on to our next question. What are the key factors that healthcare professionals should consider when discussing oocyte cryopreservation with their patients?
Okay, then the one key factor that we need to check before we do the procedure is whether the patient is healthy or not. You have to ensure that she doesn't have any medical problems or illnesses which can complicate the procedure. Example, hypertension or even bleeding tendencies. So ensure that she is healthy for the procedure. Secondly, she has to understand that during the injections, she has to reduce her physical activity as her eggs will be growing larger, where we're going to overstimulate the eggs, and they feel a bit of pain and cramps and heaviness of the lower tummy. Thirdly, they have to understand that they'll be undergoing certain procedure like under anesthesia, where they have to get admitted to the hospital or the clinic, and they have to be off work for a few days to undergo this procedure. And after which, when they go home, they have to refrain from intercourse or refrain from any physical activity again, because the ovaries will be all enlarged and big, so they'll definitely have a lot of discomfort. So they may have to take some medical leaves for about 3 to even 7 days at times, and then they have to see a doctor again after that for assessment to ensure that they have recovered from the procedure. The other thing that you should understand is that these treatments are not 100%. Okay, so sometimes depending on when we see the patient, so if we see a patient in the older age group like age 40 and above, we might not be able to get many eggs or many healthy eggs from them. So the number of eggs that we're going to get is all dependent on her ovarian reserve. Hence we do the test called the anti-Mullerian hormone and her age. If her AMH, anti-Mullerian hormone, is high and she has many eggs and she's young, for example age 30 plus, then yes, you can get many eggs, more than 20, even 30 eggs at times. And more eggs they have, the higher chances for them to eventually get their baby. So the overall number of eggs that we try to achieve is between 10 to about 20 when they're younger, but unfortunately when they're older, they need many more eggs just to achieve one pregnancy. So some of them may have to undergo the process repeatedly again, maybe twice or even 3 times to get the sufficient number of eggs for them to achieve a pregnancy in future. Then there's also another risk where during the thawing process is very good nowadays, where the thawing rate is more than 90%. But as I mentioned, as they get older and older and the number of eggs gets lesser, the quality can be jeopardized. So sometimes at older age group, they have 1 or 2 eggs. When you thaw them out, it may not survive. So they have to understand that there's always a failure rate which they have to understand. And once they have thawed out the eggs and just say it survives and we create the embryos for them, then there's always a success rate which they have to understand. And the success rate can be anywhere between range 30 to even 70%. So end of the day, unfortunately, no matter what we do with all the advancements we have, the success rate for an IVF pregnancy rate is still not 100%. So these are the things that we need to inform the patients in advance before we do the procedure.
How has technology and success rates of oocyte cryopreservation advanced over the years?
One of the most important advancement in fertility treatment is a procedure called vitrification. Vitrification is where it's known as fast freezing. So this procedure will ensure that the eggs are frozen in glass state form, so they avoid any ice crystals forming inside. Because if you have ice crystals in either the embryos or even the eggs, then that can damage the cells. So vitrification is one way of one very important advancement in field of fertility. Number 2, the medications that we have. The medications and the injections to grow the eggs have improved tremendously, and they are very good and potent. The procedures itself to retrieve the egg. Nowadays, there are many fine and small needles that can be used to retrieve the eggs and to cause minimal discomfort to the patient. So all of this together, and of course pain management to the patients which we're going to give them, they also will help to improve their overall experience. Now, you spoke about success rates. Success rates are very good. If the egg quality is very good, then at times we have the thawing rate of more than 90%. And once they are ready to get pregnant, when we inseminate those eggs with those sperms, then the success rate will depend on the age group. Example, if they age 30, 35, then the success rate for a pregnancy can go up to about 60, even 70% in certain conditions. So overall, with the advancement we have, success rates are very, very good.
Now let's explore ethical and emotional considerations. What potential ethical and emotional considerations should healthcare professionals keep in mind when recommending oocyte cryopreservation?
Well, the number one ethical would be to ensure that when we counsel the patient about the procedure, we also have to manage their expectation. Like if the patient in the older age group, we cannot tell her that everything we find 100% success rate on retrieval process, thawing process, and eventual growth of an embryo. So we have to tell them the truth, basically to manage their expectation. The other ethical issue is for the patients herself, her own beliefs. Like some patients, certain groups of patients do not agree in freezing embryos because they feel embryos are still they are a life form. So hence it's they do not want to freeze the embryos, because sometimes when you have many eggs, then you end up having many embryos, and a lot of patients don't use all the embryos, and there will be a chance where there'll be a moment where you'll be faced with the decision to discard those embryos. So a lot of patients feel very upset and bad. Some of them even emotionally they get very affected by that procedure. Hence the oocyte cryopreservation actually a very good option for them. The other thing will be the emotional part. As I mentioned, success rate is not 100%. So we want to ensure that they are supported emotionally by kind of social. We have groups which are patient-oriented groups, which will help for them to understand the whole process. And we have a kind of care line where they can call our counselors and can speak to them directly, because usually in patients where the outcome is not as good as you want it to be, and then they need a lot of emotional support. That means counseling and explanation and some sort of support for them to be strong again to try the process another time. So these are the only ethical and the emotional parts which will be affected in this group of patients.
Now, are there recent studies or findings regarding the long-term outcomes or safety of children born from cryopreserved oocytes?
Yes, there are many studies. There's one study where managed 400 over cycles of patients that underwent oocyte cryopreservation, and the outcome was very good. And many of the studies recently have shown that even from our centers too, where we have seen patients who eventually got pregnant and delivered healthy babies without any problems. We had patients who had first cryopreserved or froze their eggs, and the husbands who had frozen their sperms. Eventually we inseminated it and we got the embryo. Embryo itself was frozen for some reason, and eventually we did a frozen embryo transfer and she delivered her baby. So these things are very common nowadays with these advancements in this field, and the safety profile has been fantastic. So these patients, these babies, children are perfectly healthy, just like a normal child in the general population. So it does not affect the child. And another point that I'd like to add for the woman itself, a lot of women feel that if they were to do egg freezing at a younger age group, then later in their life they will have to do an IVF, then do a frozen embryo transfer. It's not true. So these women are healthy and they're not ready to get pregnant yet. And once they have found a partner, I would advise them to try naturally first. Try to get pregnant naturally, maybe 6 months or a year first. And if they fail to get pregnant, yes, then they can come to our clinic and then we can use those eggs. But lots of patients eventually be surprised that they conceive naturally once they have started trying. Because as I mentioned, these patients are quite healthy. So there's no long-term effect to the embryos or the babies in later life. There is no effect to the women either. They can still conceive naturally and deliver healthy babies. So basically, this oocyte cryopreservation is just like a backup plan for lots of women, and so at least that they know that they have preserved their fertility, so they've removed the stress of their lives, so they can move on with other things in their lives too. So it's a form of, I would say, women empowerment. So I think it's very good.
Now for our final question, for healthcare professionals that are less acquainted with this technique, what resources or guidelines would you recommend for integrating oocyte cryopreservation into their practice?
Well, there are many guidelines now available in the internet. The important guidelines you can be found in the ASRM, the American Society of Reproductive Medicine website. The other ones, the ASHRAE, the European Society website. They have lots of data from guidelines, or rather information about oocyte cryopreservation over there. So you can access these websites, and there'll be a lot of information available there.
Thank you so much, Dr. Navdeep, for your expert insights, for your time, and for sharing your valuable knowledge on this topic in today's podcast. Definitely, Doctor. We're also looking to have wonderful podcasts with expert doctors like you on our platform. And to our audience, we invite you to become active members on MedSynapse, connecting with doctors and medical professionals. Don't forget to like and subscribe to our YouTube channel for more educational videos like this. Your engagement helps us continue to bring you valuable insights. Thank you and have a good day.